right, thank you, and welcome back, everyone, to the Edge of Healthcare Lessons from Leaders to Use Right Now. My name is Martin Cody, host of this webinar and podcast, and I am thrilled to have with us today Kim Lynch, CEO and founder of Metis Healthcare. So, Kim, welcome.
Thanks so much for having me, Martin. It's a real delight.
I'm looking forward to digging into Metis, but you've been in healthcare a long time, and I want to kind of paint a story of history of why did you get into healthcare and what was your first job in healthcare?
Sure. Gosh, first job in healthcare, I could maybe stretch that argument back to my lifeguarding career, but I'll pull it forward a bit. And I started out in politics, actually doing committee work and really enjoying getting close to community needs was really what I loved about that work. And through that process, I ended up working on both my undergraduate studies, pointing them more and more towards healthcare. I knew that that's probably what I wanted to do, and then concentrating, as well as getting a job in the governor's administration, first in constituent services, and then in the policy office in health policy. So nailed the dream job really out of the gate, but it was through really being close to the everyday people's stories that I was seeing and hearing and learning about in both the classroom and experiencing then on the policy and policymaker side. But I'm the daughter of an anesthesiologist, so I don't know a time in my life where I wasn't thinking in terms of healthcare.
Sure.
For clinicians and patients. Yeah.
Your proximity to healthcare started at birth, essentially, from a standpoint.
Yes.
The working on the committee, that side of thing for the community needs, how old were you for that?
I started out doing committee work when I was 18. And then go ahead.
In college, you had a bunch of, I guess, poli-sci focus, and you were working in that capacity. And then the job out of college was working for the governor?
Correct. Yeah.
Which governor or what state?
Governor Jennifer Granholm of Michigan.
Okay.
And it was awesome. I actually had every intention of going straight from undergrad into grad school. So I was studying for that. And my now husband and I had worked on her campaign because I had been on committee staff. I was already, well in with the awesome campaign team there. And then when she won, I got the offer to join the staff, and I was like, you don't turn that down ever. So I put off grad school, and it was such an incredible experience. And yeah, I loved every second of it.
That does sound like the dream job. Right.
It was amazing. I mean, and it was also the time when West Wing was very big. And so we had West Wing watching parties. It was a very good time to feel optimistic about public service. And I love that. I love the idea. And my father, through not just his practice of medicine, he's a specialist. He's an anesthesiologist. I would joke with him all the time about he's not a particularly useful doctor if you break your leg in the woods, right? Like without his tools, right. He's not super helpful. But that act of service and the mentality that I saw him live was totally my inspiration for going into public service, and that your work should be in service of something that you find exciting, but that does good for the world. So I saw that my dad did that through his practice of anesthesiology and just being a pretty cheerful human wherever he went. And for me, it was finding my initial footing in my early career of where within the public service landscape was I most excited, and did I feel like I could make the greatest contribution.
And I'd be curious, working at a fast-paced environment like that, at essentially on the governor's team, what were some of the takeaways that were unrelated to the West Wing that you left that capacity with that continue to serve you well today?
The list is endless. The first thing I will say is the mentorship of the people in that office. So they could not have been more generous, of the mid and late career folks to the folks younger career. Like that really preceptorship was incredible, whether it was on the most, boring but quite consequential budget matters that you'd never dealt with, that
Right.
early in your career, all the way to understanding the ego dynamics at play as we negotiated health information exchange policy and stood up those negotiations. Something that you said actually before we started recording. I had the Michigan healthcare marketplace described to me as a mafia when I was this bright, shiny 20-something saying why they're saying the right things, that they want to cooperate and share data. This is how naive I was. I can't wait for folks to hear this and laugh. As this bright, shiny 20-year-old working on health information exchange, I couldn't understand why they would say one thing and then the actions would be quite counter to that when it came to actually exchanging information. So this is pre-High Tech Act, right? Like so naive of me. And it was mentors in the administration who were like, because this is like a mafia. This is turf. And, the amount of lessons that I learned in that experience. I don't mean to paint everyone with the same brush in Michigan. There are such incredible organizations and institutions. But the tectonic plates feel very firm in Michigan as well from a system and a landscape perspective. And I see now how much that chokes off innovation. And I think that's what those, early mentors were signaling of. And what that was the lesson that I took from it was don't pound sand here. This isn't going to change. These are really well-grounded dynamics. And that if I wanted to have a real impact, it might not be there and in that effort to spend my time.
It's a great answer, and it's fascinating because I think those of us that still are naive and maybe altruistic, thinking that we can impart some change in this industry where we are pounding sand and pounding our heads against the wall, those factions are still well entrenched. And to your point, I do think it stifles innovation, and I do think it stifles disruption. It stifles advancement. It stifles. The healthcare is one of the only industries that I know of that still uses fax machines, and they're single-handedly keeping the fax industry afloat. That's a lack of leadership, a lack of innovation, someone's benefiting from that. It's not all of us as consumers of health. But from there, so I appreciate that answer, and I also appreciate that candor because I think you're right. And unfortunately, I don't think it's exclusive to Michigan.
No.
The challenge we all have is how do we break those walls down?
Right.
From there, where did you go?
So, wow, what an excellent tee up. From the Granholm administration, I was invited to join Blue Cross Blue Shield Michigan, and I was there for about 18 months. And I will let folks read into that. Again, there are amazing folks at BCBSM, but it wasn't the right fit for me. And so from there, I actually went into consulting. There was a consulting firm in Ann Arbor, Michigan, that is a nonprofit that was transitioning from doing a lot of military health system and military focused research into military health system and all health system research called the Altarum Institute. And I went there and absolutely loved it. It was a great time to be in health tech. And I got to build everything from participate and build, to be clear, everything from syndromic surveillance systems to disease registries and immunization registries. And it was really my first exposure to workflow redesign at the edge of where healthcare was. So in that case, it was working with local public health nurses, epidemiologists, and development teams. And I was the person gathering requirements across all of the various stakeholders so that local public health nurses could administer the vaccinations needed at the point of care and perform outreach to patients that were not crossing their threshold. And it turns out that those two workflows, while very straightforward, are actually rather difficult to pull off. And consulting and being able to bring people together is really what I got to do there. So we also put together the High Tech Act response for Michigan from that company. And what we stood up was the Michigan Center for Effective IT Adoption, quite a mouthful, but helping doctors adopt electronic health records and take advantage of the meaningful use incentives. So that's where my doctor father likes to introduce me as responsible for meaningful use. And I'm like, no, I assure you, was there, participated in policy, was not single-handedly responsible, but all joking aside, it was such an instructive workforce effort, technology efforts, and missed opportunity, to your point of the dynamics of the healthcare industry. It really has served to line the pockets of a very small sector of healthcare, and it has not delivered on the interoperable, population health promises that we started out with. So I think we did a lot of good in that work, and there's a ton of unfilled promise and potential.
It's amazing how much need there still is. And even if you go back to the syndromic surveillance and getting all of the emergency departments to be in sync. And so you can see respiratory distress triage cases on the rise, and maybe there's an airborne something or other that we need to be aware of in this city, and someone were, it's a dirty weapon or something. Some of the promise is still out there, but the need is probably far greater than it was 25, 30 years ago when we started talking about that.
It's so true. I mean, this is such a funny aside, but it's one of those stories that, you couldn't make it up. When I was working on the syndromic surveillance systems, I actually went to the Taste of Chicago and got salmonella poisoning. There were headlines, and I got to effectively trace my own, I got to trace my own case through the process. And it was such an instructive moment for me as a patient, right? And as a builder. And to your point of like all this unfulfilled potential, like, holy cats, we are not even scratching the surface, right? In part because back to the instructive times in Michigan, we're still so busy hoarding data in so many cases that we don't leave space for real innovation. We talk a good game in a lot of cases, but the time and the effort tell a different story, unfortunately, too often.
Right. Agreed. And it seems consultancy gets I think, a bad rap.
A lot of it earned, but yes.
And I was going to ask you why you think that is, but I think you may have just answered it.
I mean, yeah, I have a strong opinion about it, and I would love others' thoughts because I have thought about this a good bit. I think consulting is wonderful when you're using your tool set for good. Mm-hmm. I think consulting is a real problem when you show up and say, tell me what the answer you want to be, right? Tell me what you want the answer to be. And too often consulting is tell me what you want the answer to be, and I will make the data tell that story, right? That is selection bias 101. And as a public health person, you don't get to do that in my business. You don't get to do that in my science, right? Like you start with everyone. You don't get to say bad data, we drop them, right? Like they don't have the ability to pay, you drop them. It's everyone is your starting denominator. And yeah, I loved being a consultant. Oh my gosh, it is some of my favorite work. I still talk about so many of those projects. There's plenty of good and bad, but I think a lot of it comes down to, are you advancing? Are you using your skill set to do good within the industry, or are you perpetuating obfuscation? Are you perpetuating power dynamics? Are you perpetuating the siphoning of resources from their intended purpose? Like all of that is wildly present in healthcare. Mm-hmm. And I think that's exactly where consulting gets a bad rap, because there's a ton of money to be made in some of those not so great tricks of the trade.
Right. And certainly a lot of resources squandered with very little to no results. So after the consulting gig, and we can bash consultants forever, but I'll abstain.
I love consultants. Just use your powers for good.
And put the patient first.
Yes. Because we're all patients. That's the thing about being consultants or any role in this healthcare system. We are all patients. We all will be patients. And that is the point of empathy that I would hope we can all access and act upon and within as we do our jobs.
Agreed. And I think there needs to be more empathy exhibited and taught at the highest levels, because then that could be perpetuated from the top down, which is where it should probably originate.
Totally agree. It's also good business. I mean, I can make the argument on hearts and minds, right? I can also make it on an economic playbook that balancing the needs of your workforce, especially when that workforce are clinicians and staff that are caring for your patients, Yeah. You like, there's definitely a bridge too far. And a lot of organizations have found that bridge too far. But I think we're in a rebalancing period. And I look forward to the organizations that are investing in their people and rebalancing that equation being the ones who do the best in the next, 5-10 years in healthcare.
I completely agree. I'm excited to see that chapter unfold quickly. Speaking of that type of organization, I think you left consulting and joined an organization that is largely from that ilk, if you will. Talk to us about that.
Sure. Well, so I went from consulting into the federal government. So I was at ONC.
That wasn't the one I was talking about.
Yeah, I think you're talking about after that. So in Michigan, that was my first startup was that MCDA, helping doctors get onto and use their first EHRs. And then I came out to DC to run first the Regional Extension Center program nationally.
I remember those.
That was the program in Michigan that I was running. And then I came to run that program nationally and eventually all of ONC's portfolio. And then from there, left ONC to be part of the founding team at Aledade. And that was, it's incredible to say this, 10 years ago now. So just 10 years ago now, I have distinct memories of reviewing some agreements over the holidays of 2014 at various times. We started Aledade, and it was absolutely incredible, and still a ride that it's tough to really see the magnitude of where we were and where we are and its role in changing the ecosystem. But it's pretty incredible to see how, again, the tectonic plates are shifting. The ice is starting to break up, whichever metaphor you like. And I think Aledade has really been in the right place at the right time, proving out such a necessary demonstration of innovation, like we were just discussing, that there really truly can be innovation.
I want to pull on a couple threads there if I look at your career longitudinally. So this is amazing experience that not many people get to have in a very short period of time. So you worked for a local policy government office, then you worked for the governor's office, then you worked for a consultant, then you worked for the federal government, and then you go from the federal government to, on the way other end of the spectrum, a startup. And
I was also pregnant with our third child, so it was some ridiculousness from a life perspective, but yeah, it was a huge pendulum swing.
Yeah, I can't imagine a larger one from that standpoint. But I'm curious as it relates to skill sets that were required at each stop along the way. What do you think is the consistent thread in all of the skills that you either brought to the job, learned on the job, or refined while there that continue to serve you today?
So that's a big, big question. I have a starting point, and maybe I can give a couple of examples. My starting point would be my public health degree really helped me understand the macro dynamics of healthcare. And I would not have described it as such at the time, but experiencing healthcare myself, experiencing healthcare through individual use cases or problems, and then zooming all the way out to the macro, start with, 330 million Americans and work your way in, and the ability to toggle between the individual experience and the population level outcome, and then the individual experience. And that back and forth, that toggle, I would say, is probably the skill set that I have used the most, certainly in entrepreneurship, because it's that ability to see, a single experience of care, a single payment, a single day in the life, and making that better, making that demonstrably, tangibly better. As far as other skill sets go, I've long had a strong interest in behavior science. I've done a little research in that area. Just the most basic understanding of how, what we respond to, why we respond the way we do as humans, and how that affects our healthcare and what we do or don't do is fascinating as a patient, as a caregiver. And it also helps you understand the alignment or misalignment of incentives, which is probably the skill set that is maybe the most obtuse, but is the one that I'm trying to really sharpen. I'll say at this point in time is there's talking a talk and there's walking a walk. The practice of aligning interests is not a one-time thing. It is something that you have to check in on, readjust, right? Whether it's a clinician and a patient and their care plan, there has to be an alignment of interests, right? And I would say that my discernment has certainly gotten better over my career of getting quicker to, is there a real alignment of interests here? And therefore my time, my effort, can maybe accelerate, or is there not really an alignment of interest here? Is there, talk, but not a lot of walk, in which case I could either pound sand or I can maybe cut bait and put my time and effort somewhere else. And I think that maybe that skill, that bonus skill of discernment, I've gotten a lot more comfortable with that cutting bait with my energy and moving on. And that's been great. That's been really fun too.
It's a huge asset when you can refine that skill of cutting bait and not continuing to invest personal, emotional, physical resource after physical resource when there's no alignment and nothing's going to get done and people are just merely talking the talk but not walking the walk.
Well, and plenty of times, if we take, any judgment out of the situation, a lot of folks just aren't ready, right? Like I've worked in value-based care for the last 10 years. It's a huge change. There were plenty of doctors, office managers that I've spoken with that were not ready then, but maybe they were ready a year later or after something else changed in their landscape. And I think this is where, even if it's just conceptual, even if it's just, what might the future look like, I think that's really healthy for us in the healthcare industry to start imagining and then to start telling the stories and hearing the stories of the folks that have made the leap and how they've done it. It changes what I think obviously has been a really tough 5 years for healthcare and hopefully starts giving us a little hope, right, in a very tangible way for what the future could look like and how clinicians, operators, right, and even patients can participate in building what does the 21st century healthcare system actually look like? And how do I put my thumb on that scale of aligned interests and not, tolerating or just moving through, right, the misaligned interests of last century?
Do you think that that plays a role in your decision to A, join a startup, and or B, where you are now being a CEO and co-founder of an organization where you can call the shots and say, I'm not dealing with that BS, let's just focus over here.
Yeah, it does. A lot of folks on my teams over the years will recognize this thought pattern. I'm a very ROI-driven person, return on investment, and that's how my brain tends to operate. And the measure that I give for myself is, where did the time go? And so I evaluate myself on kind of beginning of the week intention, end of the week intention, and I get really frustrated when my time is going not where I want it to go. So if it is going to the category that I often refer to as like administrivia, sometimes there's, like the necessary, right, but you're just going to have to get through it. For me, entrepreneurship has been the most right balance for me of administrivia to being able to put real impact on the board that I can be proud of.
Well, and I'm interested in the entrepreneurial angle.
Sure.
Because it's not something that people gravitate towards. Sometimes someone had a lemonade stand at 5 or what have you, or was doing creative things, and you can tell these individuals are like, that person's going to start a business someday. And you see that from a distance. Where did you acquire it?
That was not me. Yeah, I definitely not. I know those people. I'm fascinated by those folks. For me, I've only recently really become comfortable labeling it as a calling. I didn't want to do this. This was not my plan. We were joking about the West Wing. I'm a guy behind the guy person. I'm the operator, right? Like I like to tee things up for doctors, for nurses to hit it out of the park. That is my happy place. I like making a machine work. This realization of what we're working on with Metis, it was a realization that came over really close to a decade of of various like moments. And then once the pieces had really fit together, I couldn't put it down. I could not put my brain down from thinking about the problem. And
I want to talk about Metis. I want to talk about Metis now because it's borrowing a term from the 90s. It's synthesizing all of your experiences and what you just said you were observing, and now you've built a solution for it. So what is the problems that your entrepreneurial new stud self is solving?
Sure. So at Metis, we are helping clinicians take control of their time and their money. And when we say that, we mean helping them understand their full patient panel and their full resource and revenue portfolio so they can rationalize about both and set priorities against both. So right now, if you are a solo doc to a community hospital to a federally qualified health center, you are running probably multiple lines of business. Mm-hmm. And if you're not, single points of failure are another business risk we can talk about, especially in the wake of the Change Healthcare cyber attack and how even the surest thing sure isn't feeling that sure here in 2024. Still rippling, indeed. And with that uncertainty, being able to understand your whole panel and all of your lines of business and where you are being paid as expected and not as expected is essential. Most clinical businesses don't have that visibility, so we start there. We help those businesses plug holes in their current payment and give them a little breathing room so they can get strategic on their patient populations, specifically around quality measures and bonus payments, quality incentives, all the different ways that they can start aligning their time with ways that they can run up the score for their patients and their business at the same time. There's that aligned incentives game. And lastly, we help them start really playing the what if game. What if this patient population was in a value-based arrangement? What might that look like? What are the types of partners that I might be looking for in the ecosystem for maybe direct contracting to help me accelerate or advance my business? And again, this idea of a full portfolio of all different kinds of patients and all different kinds of economic models, what Metis does is gives you the ability to manage all of that in a day over day, week over week, quarter over quarter basis.
One of the things I see with physicians today is sheer exhaustion.
Yeah.
And I'm wondering how, if a physician is listening, and there will be a few listening, how do you get them over the hurdle of, listen, I walk out the door at 7 p.m. I will dictate notes. I have to do this. I've got a family. I'm missing recitals. And it's just one more thing that I have to do. And there's a long list that I'm not even getting to because regulatory wise, they've been burdened. There's prior authorizations, everything that is being put upon the physicians. How do you get them to understand the holistic value prop that is awaiting them through Metis and what it can mean to them?
Well, I would say that every single doctor I've spoken to about this has pretty quickly leaned in and said, I already understand what you're saying, whether they are an owner-operator themselves or they work for a hospital and they have heard the plight of their friends who are out practicing independently. We start with, it is really hard out there. And you are getting the raw end of this deal and we can lay it out for you. So the first thing that really clicks in for most doctors when we talk is, I knew it. I knew that there was something wrong. And so there's this validation moment of when we say, well, I'm not sure what your current denial rate is usually how we open the conversation. But most independent businesses we see are ultimately paid 3 or 4 or 5 out of 10 times. And most hospitals, if they're in kind of the high performing end, are ultimately paid 8 or 9 out of 10 times. We help close that gap.
Okay.
And that understanding of, I thought that saying that I was a $20 million a year in billings, $10 million in revenue business was just a normal way to report my business. It's not. It's not in any other industry. And we really just start with empathy for that business owner and their, admin, office manager, and say, look, it's not your fault. This is like a video game set on hard mode. but you've been playing without resources.
Right.
And so really that first conversation is tell us where it hurts for you, or if you're not even sure, let us return a quick diagnostic of here's where we can see you're being paid and here's where you're not being paid. And then let's set priorities on where you want to change that result.
I think it's spectacular that you've been able to draw upon your rich, diverse background of experiences to then somehow find and identify an entrepreneurial cap and embrace that, because that often is not an easy path to pursue, because everyone's stories about entrepreneurialism and worried about making payroll and laying on the kitchen floor, wondering how that's going to get done and taking on investors.
I identify with those feelings, though, rest assured. Yeah,
I'm sure you do.
It's not for the faint of heart, that's for certain.
But you also hearkened back again, and we heard the word empathy. And so if we can practice that a little bit more, I think good things will result from it. And you're certainly you're walking that walk and talking that talk. So I'm very appreciative of what you're doing at Metis. So congratulations on that.
Thank you. I mean, it's my delight to get to learn from the doctors, the nurses, the administrators out there who are working so hard. So I'm here at Northeastern University up in Portland, Maine, their Portland, Maine campus. And we are part of a portfolio of companies here at the Rue Institute. And it's been incredible to see the ecosystem that they are building for folks to learn together, and how intentional even the state of Maine is being to help folks learn together and to support entrepreneurship. I think we're at the very beginning of making it a little easier for one another, hopefully, by learning together and realizing that while there's plenty of competition in healthcare, we need to get creative and redefine this century's playing field. And my line on it is that alignment of incentives. And I would hope to be able to really de-risk it, quite frankly, for a lot of other clinicians and administrators to also experiment within their own businesses or to make an entrepreneurial leap. Because I can think of fewer things that would have a better effect on the U.S. healthcare system than a lot more innovation happening at the edge of care.
Right. And it's an interesting name for a podcast, too, The Edge of Healthcare. I like the way you wove that in there. If you were to give some guidance to someone that's been in healthcare for 4 or 5 years, and they could be clinical, they could be administrative, they could be at a startup, you've been able to recognize the capability and skill of fish or cut bait, get to know fast, if you will, type of thing, and not squander resources, lead with empathy, walk the walk, talk the talk. What other items would you tell someone, this is how you follow and identify your path?
Follow the feeling. Follow your qualitative sense of where the need is, where your interests are. Like that's that alignment of like what really like lights you up. Plus, obviously what the world needs, and look into and listen to not only those reactions in yourself, but in your community. Mm-hmm. I think that we're a little too locked in. This really is a theme that we're talking about today. We're too locked in still in last century's paradigm. I think there is a lot more possibility when folks realize, just because that's how we've done it before does not mean that we have to do it this way. I'm seeing so much cool innovation, for example, in direct primary care, and watching employers have these amazing moments of investing in their employees really promotes healthy businesses for them, right? Healthy employees, healthy businesses. And that's awesome. That's a really cool thing that wasn't happening 10 years ago.
No, and it's interesting because when you look at it at the surface, it's like, well, that's not rocket science.
It's not, but it wasn't happening before.
No, because everything was misaligned. And speaking of misalignment, let's get to the segment of the podcast to where we're going to play the word association speed round.
Ooh, fun.
And I'm going to say a word or phrase, and you tell me the first thing that pops into your head. Ready?
Okay, sure.
CJ Craig from The West Wing.
Oh, she's so tall and has the best one-liners. If only I could have the CJ Craig one-liner machine in my brain, I would be so delighted.
For
Allison
80%,
Janney is a national treasure. That's what I want to say. Allison Janney is a national treasure.
awesome. And I can't believe I remembered her last name. It just came to me. So I'm glad.
Well done. Yeah.
Thank you. Medicare Advantage. I think you just set enough
relationship
right there.
status, like it's complicated. I mean, I have seen an N of 2 of really excellent, really well-aligned Medicare Advantage plans. That ain't a great batting average. That's what I would say. And so do I think that it is completely hopeless? No. But do I think it's really hard right now to be one of those great, outstanding MA plans and separate yourself from the cacophony of folks that are not doing the right thing with the resources and are really taking advantage of imperfect design? And I understand it, right? Just because it's legal, though, doesn't make it right.
Correct. We see a lot of that.
We sure do. We sure do.
All right. This one seems to be everywhere. Artificial intelligence.
AI. I think that AI is just the next thing that we're going to figure out how to use responsibly. And I understand the fear and concern around it. But I've also met doctors, and there's no patient that I know of in the country that is going to prefer a computer over a doctor. And I have seen clinicians using AI and experimenting with AI in really responsible ways that absolutely give them tremendous leverage. So I think where we are really headed with AI is once the panic subsides a bit, that we're going to see clinicians and care delivery that is augmented by AI becoming the next standard of care, but always through the clinician, always through appropriate use of the tool, just like every other previous new tool that has entered the practice of medicine. Yes, exactly.
All right, last question. Anyone in healthcare related, living or deceased, who would Kim want to sit down with and pick their brain for a considerable length of time? Who is it? Who is it? This isn't like a quick interview. This isn't like a speed dating. You're going to sit down, you're going to have some quality time with them. Who is it and what are you drinking?
Well, we'd certainly have to meter the alcohol. But the first name that comes to mind that I really would love to hear the long range view is Ted Kennedy. And the various negotiations and near misses of his career in healthcare. And what are we drinking? Again, we're going to have to meter it, I think, for me and Ted. But certainly a good scotch. I'm a big fan of Lafroig or something like very, very smoky in that vein. So I think that would probably go over well. But again, I'm a one drinking out kind of gal, thinking that Ted, I'd have to pace him a little bit to really like get through the whole conversation.
I think you might be correct. Kim, I am thrilled to have this time together. I really appreciate the insight and especially the consistency unplanned of some of the messaging that you have. You know, stay true to your word, be empathetic, walk the walk, talk the talk. Those sorts of things, get everything aligned. I mean, those are very powerful things from a wisdom standpoint that a younger generation could say, okay, if I'm going to follow my heart, where am I going to follow my heart and listen to the cues? And it could be anywhere in healthcare because there's just so much opportunity. So congratulations to everything you're doing at Metis. How does someone get a hold of you if a doctor is listening or a health system is listening and go, we need to help our providers and we need to get more aligned?
Oh, that's incredibly kind. First, I would say I love to listen to the people closest to the work. And so I would love to hear your story and certainly happy to share more about what we're working on with Metis. But that is really incredibly kind of you to say. And that listening to the people closest to the work for me, whether it has been something absolutely brand new to me in my career or something that I've done hundreds of times, that is the advice that I give myself. It is the advice that I give my teams. And it's the advice I've been trying to practice really for 20 years in my career. So it's pretty simple. And you're right, it does lead you to all sorts of really good places. So yes, if you'd like to get in touch with us, we are metishealthtechnologies.com or getmetishealth.com. And we would love to chat with clinical business owners of any size, employers, really anyone who is trying to align interest in the healthcare ecosystem. We want to help you tell that story quantitatively, qualitatively, clinically, financially, so we can really tell that story of who's producing better outcomes at predictable costs and really run up the score for everyone.
I like it. And I think you're driving to immense value with trying to find and create more time for the provider and certainly more revenue. So those are two very important things to quality of life. Thank you for sharing what you shared. I look forward to the podcast being released soon and seeing what the feedback is, and make certain you call or get in touch with Kim at Metis and she can help your organization as well. Stay tuned for more episodes coming from the edge of healthcare. Take care, everyone.